Hello, and welcome to our poster presentation. My name is Elizabeth King, and I'm the Senior Nursing Director for Inpatient Medical Programs. And I wanted to share with you our recent poster we did on an innovation project. The name of the poster is Piloting a Remote Resource Nurse Care Model on 2 Inpatient Medical Units, Lessons Learned. So why did we really create this poster and create this feasibility project? Really thinking about nursing shortages and nursing staff turnover, we decided to see how a virtual nurse would be able to assist the patient care nurses who are there in real time. Some of the effects of the COVID-19 pandemic led us to have lots of different virtual platforms. We thought this would be a nice opportunity to think about how could we continue on in that platform. The other reason that this was a major project on our inpatient units is that with COVID-19, a number of our experienced nurses had some turnover or were looking for other remote opportunities, and we didn't always have the right people at the bedside to provide that expert level of care. This was a feasibility pilot on 2 of our inpatient medical units, 8 Mandel and 7 West. 8 Mandel is a unit that was brand new last year. And so we really wanted to explore the feasibility of implementing this remote resource nurse on both 7 West and this new unit, 8 Mandel. We wanted to really dig deep and understand what nursing tasks could be supported by a remote resource nurse. And we also wanted to understand, what did the nurses think about this? Was this helpful? What are the opportunities for improvement for this role? What are some things that we could do differently in our patient care? And then what were the barriers to implementing this role on these inpatient units? We did a 10-day feasibility pilot last year in December, and we utilized a proficient or expert resource nurse to be on a Zoom line from 7 p.m. to 11 p.m., sort of the busy part of the evening night shift. The remote resource nurse was able to have the proper equipment and technology support for the on-site nurses, and really provided this nurse with some focused education on how to be able to work with staff to do some critical thinking. We also provided some training and some journal articles and some other forms of education for this remote nurse, so they felt really primed and ready to go to be on this Zoom line. The remote resource nurse was to attend nursing report, any sort of evening huddles that were going on in the unit. They also answered questions with the staff, provided support by looking up policies, procedures, helping with med administration if there were questions behind the scenes about dosages, double checking dosages. They also did a bit of a chart dive to kind of understand what was going on with the patient and to help the support what was often a very novice nurse who was working the shift. In order to understand how we did with this pilot, we did create pre and post surveys and administered them to the nursing staff before and after their shifts to really better understand their use of the remote resource nurse and to gather what information and feedback that they had with their experiences with the remote resource nurse. So we had some interesting findings. It was very well received pilot, and we appreciated all the feedback we got from the staff. They were able to support the on-site staff nurses. They help with things such as triaging patients, looking at chart reviews, looking at patient monitoring, for example, a sepsis screening tool, and assisting staff when a patient needed to have a sepsis screening done, and provided real-time feedback about what was going on with their patients. During this time, we also had a brand new charge nurse and also was able to support that person in their role. 100% of the nurses responded to the post-pilot implementation survey, interacted with the remote resource nurse during their shift, and 84.2% of staff surveyed would like to see this role continue. So we really were able to prove that this pilot supported the development of new innovative and digital health models that we hadn't previously utilized before on our inpatient units. We are continuing to gather some of the feedback and some of the data from this pilot and are utilizing this to help with new integration of care delivery models, especially as we manage some staffing constraints and manage some of the challenges that COVID-19 has left us with. We continue to really ensure that we have enough support from the nursing staff at the bedside and that we've engaged them to be an integral part of this process and really hope to move this project forward in the future. Thank you, and we would welcome any feedback that you may have.